Microphone. So my name's Melanie Chappell. I am a pharmacist with the University of Maryland Shore Regional Health. My partner, Kelly Alexander, is also a pharmacist. She actually mans the pharmacy up in Chestertown at the hospital up in Chestertown. So we have a vast variety of experience. I've been a pharmacist for 24 years. I am currently in a very oddball job for a pharmacist, okay? I am considered what's called a transitions pharmacist. I tell people I have 1 foot in the door and 1 foot out of the door of the hospital. What's happening is hospitals are getting in the business of trying to keep people out of the hospital. We want to keep people happy and healthy in the community. So some of the things I actually do in my job is I go to all of the senior centers in Kent, Queen Anne, Talbot, Caroline, and Dorchester counties once a month, and I'll do a medication talk. And then I'll meet one-on-one to help break down barriers for people that have with medications. Now, Kelly has wonderful experience. She actually was an owner of Stam's drugstore in Chestertown back in the day. So she has a really good wealth of information about working in small town pharmacies, which is very helpful for our rural community. She's now, like I said, up in Chestertown, manning the hospital pharmacy up in Chestertown. So I don't know if anybody got the little, we try to be cutesy with the title of our presentation, Medication Tips and Tricks. The tricks is kind of hopefully related to Halloween. So you'll see some things related to Halloween, related to this to try and make it a little bit fun. But really, when you guys signed up for this presentation, we came up with some just basic course objectives. We're going to definitely go into a lot of different things about this, but really we want to review basic medication safety tips for you and also, break down and make sure that you know the barriers that you could potentially have to taking medications effectively. The other thing is, we want to make sure that you can identify, report, and manage potential side effects of medications. But we're going in through a lot of other different things. Now, one of the things, this is targeting you, Bob, okay? So when we first sat down to talk about this discussion, I felt that there could be potential for us to deliver some high information about maybe some data and some technical information. Usually I kind of will target, more of a lower informational thing. But one of the things that's really important to understand, there's a lot of information, and there's a lot of, as we age, people are taking a lot of medications. And so just from this, from the CDC, 40% of people over the age of 65 are taking 5 or more medications. That's a big number, and so there's a lot of things, again, with being on a number of medications that you need to be aware of. The other thing is 90% of older adults have a chronic disease, and 77 have at least 2. That's a lot. There's potential of interactions when you're on multiple medications, so there's a lot of things that people need to be aware of when they're on multiple medications. The other thing is medication adherence is very poor. 50% is not a good number, okay? Roughly 50% of adults do not take their medications as prescribed. And there's actually correlation to increased hospitalizations and increase in healthcare costs because of people not taking their medications appropriately. And actually, what part of my job in the hospital is to kind of manage medications that people can have barriers to. And there could be all kinds of barriers. There's financial barriers. People can't get to the pharmacy. They can't manage their refills. There's a lot of things that can happen to prevent people from taking their medications appropriately. Here you go, Bob. So the other thing is, we're going to use some technical terms in this next piece. Anticholinergic medicines. Nearly 20% of older adults take medications with anticholinergic properties. Now, let me tell you what I did. This next little bullet here, I entered, how do I explain anticholinergic properties to people that do not have a healthcare background? I entered this in ChatGPT, AI, okay? Because I wanted to make sure that the information that I was given to you was not over anybody's head. So that next statement I found wonderful. It said, anticholinergic medicines is a medication that block the neurotransmitter acetylcholine. And that helps treat conditions like allergies and anxiety and motion sickness. But they can cause a lot of side effects, like dry mouth, blurred vision, and confusion. I'm going to say something inappropriate. The way we got taught about these potential side effects was a rhyme, okay? And you're going to have to use your brains for this because I'm not going to say the last word, okay? The rhyme went, can't see, can't spit, can't pee, can't. So that's how we learned to remember what the potential side effects were for anticholinergic drugs, okay? Also, real expensive. You know, the Kaiser Family Foundation published that people are spending over the age of 65 nearly, $2,000, over $2,000 in costs. And then when you're on fixed incomes, that's a lot of money. So I have some good news on that front as we go throughout that the presentation. Also, I mean, there's over-the-counter medicines that can add up to this. So there's a lot of out-of-pocket costs that are associated with medications. And you know, there are people in our community that are making choices between paying for their medications and going to the grocery store. You know, I do not want that to be a barrier for people. And, that can be really important for people to understand that there's a lot of help and resources out there to help people navigate these things. And, one of the things that the costs have just only increased as time has gone by. I mean, since between 2015 and 2020, costs went up 25%, and they're only going to continue to go up. The other thing is, when I actually took some time this past weekend and really took some deep dives into Medicare Part D. It's actually my pet topic in terms of making sure that people are aware about Medicare Part D. But the average premium for a lot of people is $33 a month, and that doesn't include deductibles, co-pays, and if you get into higher cost medicines that aren't covered by your formulary. Also, and this is kind of what I'm in the business of. I'm in the business of preventing hospitalizations and readmissions to the hospital. And there's correlation data to show that 30% of hospitalizations can be related to poor medication management. And so that's what I will say. Shore Health is getting in the business of preventing these things from happening. It's really important for people to own understanding their medicines and things like that. And we know that this really leads to lots and lots and lots and lots of money being spent by our healthcare system and our insurance companies and our government to navigate these costs. The other thing is nearly 50% of people can experience a side effect from taking a medicine. You may be out there one of those people that have experienced a side effect from those medicines. There's even just common ones like drowsiness or stomach aches or diarrhea that most people experience related to taking a drug. The other thing is, we know there is an increased risk of dying if you don't take your medications appropriately. That's very doom and gloom. The other thing is, unfortunately with those anticholinergic side effects I was talking about, the can't see, if you get blurred vision, you're more likely to fall. So some of these side effects can cause other things from happening. So if you get blurred vision, you're more likely to fall. The other thing is people report that there's poor quality of life when, they're not feeling the best. So we really want to come at you and say, how can we maximize your medication experience? It is an experience. It is trying to optimize your health by taking medicines. That really is the goal of medicines. And I, for one, am also about preventive medicine. What can we do to prevent you from needing medicines? So now we get into, I'm out of the doom and gloom part, okay? I told you all the negative data. And, the next part of the presentation are some tips that you can do. And some of them are going to seem like really common sense. However, I've been going out into the community for 6-7 years now, and I can say that a lot of people don't use their common sense. So there may be some things that say, oh, that's so intuitive, but really, there's some things that I just want to point out that you may not even realize that you could be doing for yourself to make you more in a better position to optimize your medications. So the first thing is tip 1 is to make sure that you gather all of your medications, vitamins, over-the-counter medicines, and supplements and store them in one location. I can bet that people probably have something on their nightstand, in their medicine cabinet, in the kitchen cabinet, in a drawer. The ideal place is to make sure you're storing your medications all in one spot, okay? Real important, because that gives you an idea of, I love organization too. I've seen crazy, crazy systems, and I'm never, ever going to knock a system that works for somebody. If you have a system that keeps you organized, I'm all for it. I don't care what it is. If you're taking that medicine every day and you have a system, I've seen crazy people do crazy systems like upside down bottles, and there's definitely people have their own methods. The other thing is you need to store them appropriately. So I mentioned that medicine cabinet in your bathroom. Do you think that's an ideal spot to store your medicine? No, because you are going to have variable levels of humidity in a bathroom, okay? So you can't guarantee that you're going to be getting a nice, humid-free, cool environment, and that's really where you need to store medicine. I'm going to tell a story about nitroglycerin. Nitroglycerin is a medicine that people take that have angina or chest pain. It comes in a little amber bottle. People put it underneath their tongue. And I had a patient who had a bottle that he kept on his person in his pocket. And he pulled it out and showed me. And when I opened it, all the pills had disintegrated. So what the reason why is he had put that bottle right up against his body and skin and had that humidity and the heat from his body that actually disintegrate, the pills basically broke down into powder. And so that really was a good lesson. I will say also nitroglycerin is the medicine that you need to, as soon as you open it, you need to make sure you get a refill within 6 months. It is really one of those medicines that's very susceptible to light and heat. So a lot of times people say, one of the number one questions I get is like, can I take that expired medicine that's in my medicine cabinet? I have to say no, because I can't guarantee the way you stored it. There is always going to be a maximum date that gets put on people's bottles for expiration. One thing I tell people to do, and I don't know if anybody worked in a store or grocery store, but I tell people to grab from the back, because they're going to put the bottles that expire the most. So I'm like, grab from the back so you can make it last the distance. The other thing is real important. Make sure you have a medication list that's always up to date. I will say one of the things that I find is a huge issue in our healthcare system is that you can go from the ER to your cardiologist, back to a different hospital, to the urgent care, and none of those people are we work in silos a little bit. There are some things like, your Shore Medical Group, cardiologists should be able to see your hospitalization paperwork from, being here at Shore, but we've improved, but we haven't gone the distance in making sure that we can, translate that information from spot to spot in the healthcare transition team. So, for example, I had a man who he went to Anne Arundel for a hospitalization, had a beautiful discharge summary. His paperwork that he went home with was beautiful, gave him great directions. But then he was experiencing a little bit of chest pain, so he came to the Queenstown ER. Guess what? We did not have that medication list that he was discharged with from Anne Arundel. So he got discharged. The ER is a busy spot. They're not necessarily updating medications lists all the time. So he gets discharged from the ER, and it's got a completely different list than what he had when he came from the hospital. So that man was confused, rightly so. So he did the smart thing, brought his medicines to his doctor, and I ended up helping him and the doctor navigate through those issues. But the reason why I tell that story is because if you keep your medication list on your person, wherever you are, I will say paramedics know to go to people's refrigerators or freezers to look for those kinds of important pieces of paperwork. That's really helpful. Even when you come in, if you have to come to the ER or urgent care, having that accurate medication list lets doctors act quicker for you, to be honest with you, knowing what medications you are. One of the most common things I see is people don't update their doses. So, for example, if you're on a blood pressure medicine like lisinopril 10 milligrams, you saw your doctor last week, upped it to 20, you get hospitalized, and we only have 10, well, we're going to give you 10. Meanwhile, you've been taking 20 for the last 2 weeks. So that's a very common thing for, so really every time you're touching the healthcare system, make sure you update that medication list. I also am a fan of pill boxes. Pill boxes, pill boxes, pill boxes. I don't care if you only take one medication a day, those pill boxes keep people honest, okay? How many times, if you have your pill box filled out, you walk away from it, oh, did I take that medicine? You can look and say, oh, look, Monday's still there, However, have it still in that bottle, you walk away from it, are you going to really know how many are in that bottle to begin with that you should have taken one out of? The pill box keeps you honest. And again, if you're only taking a vitamin, I even recommend it for just somebody that just takes a vitamin a day. Because again, it's a special reminder for you to kind of stay on top of that. There are so many amazing things out for people to stay adherent to their medicines. There's all types of pill boxes. If you take a medicine once a day, you get, the one strip. If you take it 3 times a day, there's a 3-1. There's even, Hills will blister pack or pre-pack your thing. There's something called pillpack.com that'll put all your medicines in one little pack for the morning, and it comes on a spool that allows you to remember to take it. So you don't even have to sort it yourself. There's a lot of devices that will suit your needs out there. I have this automatic, but this one is what we're raffling off today. I will say that is if you like technology, this is awesome, okay? It will actually, you can put an alarm in this and it'll say, it is time to take your medicines. It is time to take your medicines. So there are things out there, whatever are you hard of hearing? That's loud. There's things like that. If you have a smartphone, the number one of the biggest pieces of advice that I give to people is set alarms on your phone. My daughter's 21. She had shoulder surgery. And she needed to take a non-steroidal around the clock, and she was not doing it. She was maybe taking it once a day. I said to her, you have to set an alarm. You have to do this. It doesn't matter who you are, what age you are, what you remember. It's a really good system to help you say it. And actually, I have a weird meeting where I have on Tuesdays and Thursdays, we have a meeting at 8:15 in the morning. That is a terrible time to have a meeting. It's not so I had to put an alarm in my phone for Tuesdays and Thursdays to make me get on that little Zoom because it's an odd time. So I think if you have something that you have to take multiple times a day, those midday doses are easy to forget. Also, we're getting into making sure that you check your medicines to make sure there's not negative interactions. Now, I will say, and Kelly will go into this a little bit more, but if you are using the same pharmacy, the computer systems are very advanced now that, as long as you're making sure your medication lists are updated at your pharmacies, those are going to be automatically done for you, okay? And I actually encourage people to add over-the-counter medicines that you take. A lot of people take calcium. Maybe that's not a prescription. Aspirin is not a prescription. A lot of vitamins, or even allergy medicines and heartburn medicines. Tell your pharmacist that you take them. That's important. I will say, people don't know this, but calcium actually can interact with some antibiotics. So if you come into our hospital, we will actually time some antibiotics 2 hours away from people that take calcium because we don't want that interaction. So it's not a common tip that people hear about, but keeping all of your medicines that you take on a list in your computer is going to be really important for the pharmacy. Also, make sure your medications are clear. I mean, when you go to the pharmacy, you get a big paper, lots of paper with lots of information on there. Most people chuck it. I think the average person, there's very few people that read that information on that. So here's one of the things I say. These are called auxiliary labels on here. So the pharmacy, what happens when you go to the pharmacy, those auxiliary labels are going to be the most important medication labels, or the most important side effect, or the most important instructions that you should take heed to. So for example, if you see take with food, what do you think happens with that medication if you don't take it with food? Upset stomach. Okay, yep. Same thing, they'll also you'll commonly see may cause drowsiness, don't operate machinery. There's those bright colored labels that are stuck onto the bottle are probably the most important instructions in addition to how you take the medicine to make sure you listen to. I love reminders. I said that the alarms on the phone, I think, are really, really important for people. You know, it really, especially midday doses. We know, you know, pharmaceutical companies, their goal is to try to make a drug where people only have to take it once a day. Because we know, they know, the more times that people have to take a medicine, the more opportunity there is for them to forget to take the medicine. So there are apps. MediSafe is an app that you can set up in your phone to help you remind to take your medicines. Again, I really am a fan of using alarms. Likely side effects. This is what those auxiliary labels I was telling you about. They're going to be that's really important to understand. I actually think you shouldn't leave your doctor's office without asking the question, what can I anticipate from taking these drugs? Obviously, I want it to help my blood pressure, but what else can I anticipate if I'm being prescribed this medicine? Or what are the most likely side effects to happen? I think you should have that discussion with your doctors to make sure you're kind of prepared for knowing that. And again, the auxiliary labels are going to be the most common things in terms of side effects for you to be aware of. If you know somebody that has Alzheimer's, or if you have some issues with memory, it's really probably important for you to have somebody with you at your doctor's appointments and even helping you manage your medicines. I am an advocate for having a second set of eyes on your medicines. I think that's important. If you have healthcare professionals in your family or friends that you want to kind of run by things to, I think that's important too. I think that gives you some peace of mind that you're making the right decisions. And again, there's a lot of systems in place to help people that may have memory issues for that. So that's also something you can discuss with your doctor. So we have a lot of good systems now in place that help people. The pharmacies that you go to should have a system for you to opt into to get automatic refills for your chronic medicines. And that's really helpful for a lot of reasons, okay? So the average doctor will prescribe, if you know, most people go once or twice to see their doctor. The average doctor will say, you know, prescription can only last for like a year. So they'll give you, they'll start your refill and give you 11 refills so that you can get it filled through the year. The one thing I like about having automatic refills system set up is that, say you run out of refills. Well, guess what happens in the system? It alerts the pharmacy to say, ooh, Mrs. Smith doesn't have those any refills left on that prescription. We need to ask her doctor if they're willing to authorize that. Well, they do that well in advance of you running out. So by having the system in place, it's kind of a safety sieve to make sure that you're not going to run out of your medicine, okay? I also think pill boxes allow people to stay ahead of their refills. You're filling your pill boxes and you're like, oh, I only can fill 5 days worth. I need a new refill. So a pill box allows you to kind of stay ahead of your refills as well. That is another advantage to using pill boxes. Now, this is the part of the presentation I called tricks, because these are things that, you know, there are some that are more common sense, but I'm going to tell some stories about how I think these tips can help you out in general in terms of making sure you stay ahead of the game, and maybe little things that you didn't think about that could impact the way you take medicines. And I have Halloween costumes on each one to kind of trigger me to remember how to tell these stories, okay? So the first thing is you need to set a daily routine, okay? Irregardless if you take your medicines once, twice, 5 times a day, have a routine in place. Also, plan for things of when your routine is not going to be typical, vacations, or if you're going to be out, you know, out in the middle of the day and going to have something going on where you would forget to take the midday dose. I had a lady who came up to me and she was like, I take one medicine. I take it for blood pressure, but I only take it twice a week because I always forget. So I was like, okay, well, let's get into the nitty-gritty of your daily routine. And so she basically said to me, this was a very easy fix for me, because I said, what do you do every single day, irregardless of the day? And she said, I have to have a small glass of orange juice every single day. I don't care what day it is, I have a little orange juice every day. So I said to her, why don't you put your pill bottle next to the refrigerator? because she had it in a weird spot in her home. And so she put the pill bottle next to the refrigerator. Lo and behold, every day she walked by that bottle, and probably my triggering her of doing something a little bit different, allowed her to take that medicine every day. So it may be something, you may have some type of routine, that part of your day that you do every day that makes you make sure you're accountable to it, that you do something. Maybe, a lot of times it's coffee, breakfast, there's some type of system. I've had a lot of people say they like to leave their medicines on their kitchen table because it's just their process is to do something like that at their kitchen table every morning. So just find that routine in your day. Reflect on your day. What do you do every day to make it so that you remember to take those medicines? She was very grateful, too. Every time I see her now, I tell that story, too. So this I spent this in, I did talk about this in the tips part of the presentation, but I really can't emphasize this tip enough. Back on the table, I have some index card, or they're kind of like a card stock that you can take where you can write your medicines on there. That list of medicines is just really important. I think what I like about the list, or the blank list that I have back there, it tells you what the medicine is, how to take it, and what it's used for. I think a lot of times people need to take it. What we know is people who take ownership of their health and their medicines actually have better outcomes. So by really knowing your list and being able to spew that out in a split second, people do better. It really is very important. And again, you can bring it anywhere. You can put it in your pocketbook, put it in your wallet. There's even, micro cards and things like that. And that is really such great information for people to start from. And really, everywhere you go. I mean, if you see multiple doctors, bring it to every doctor's appointment. It's really important for that to be at every doctor's appointment or every touch in the healthcare system. Now, trick 3, I would say, this is one of the number one things I do for people, is help people navigate affordability issues regarding to medications. And this is, I will say, I'm going to get to the nitty-gritty of this part of this about Medicare Part D in a couple minutes, but there are a lot of resources out there for people to help navigate affordability issues, okay? And this goes for people that are not on Medicare. This goes for people who may be underinsured, not insured. There really are a number of resources out there for people to help navigate prescription costs. Obviously my first thing is going to be recommend to use generic medicines. I tell a story. My grandparents lived on the Chesapeake Bay down in Calvert County. And their neighbor, he worked for Safeway. And I will never forget the first time I really understood, I guess, generics or off-brand. But he basically told me that he worked for Safeway, and he was in charge of all the vegetable packaging for Safeway. And so Safeway packaged all the Jolly Green Giant vegetables, but then they also packaged it for Safeway and put the Safeway label on it. So it was exactly the same stuff. And so I'm here to say to you, there's some people that get apprehensive, like, do I need to be on a generic? I'm scared to be on a generic. I will say our government is very good at making sure that those generics are equivalent to the brand name medicines. So that is something you can take some good confidence knowing that the medicines that were brand are also generic. They're the same thing. There's also coupons out there. GoodRx, you may have seen some commercials about that. GoodRx also has actually a prescription plan. It's called GoodRx Gold. I actually recommend that for a lot of people who don't have prescription coverage through their work that may be a little bit younger. It's very affordable. It's like $10 a month, and it has great coverage. A lot of drug companies also offer, especially brand name medicines, so the big money makers that you hear out there, you've probably seen anything you see a commercial for has something called manufacturer assistance. They actually have programs that you can apply for paperwork. You bring it to your doctor, may have to give a little bit of financial information, but a lot of these programs are very generous. They're very, very generous. So if I don't like telling people to think you're not going to qualify because you'd be surprised. They're very generous, especially things like inhalers. There are a number of programs, if you have like COPD or emphysema, some of the brand name inhalers have very generous patient assistance programs that a lot of people qualify for. The other thing is, I tell people all the time, if your doctor has samples, ask for them. Because guess what? If they don't use them, they get tossed. And guess what? They toss out a lot of samples. So if you are on a brand name medicine, you should have no pride, because that's what they are there for you to use. And again, there are a lot of samples out there. Some doctors' offices don't offer them, but again, irregardless of who you are, what your affordability issues are, I always tell people to ask for samples. There's also a lot of community resources. In our counties, there are assistance programs. Some of the counties will help people pay for Medicare premiums and co-pays. The other thing is, there's something, and one of the handouts I gave you is called Medicare Part D Extra Help. That is actually a program that's run through the government that allows people to get assistance with their premiums. So it is a financial criteria that you have to meet, and they actually will help pay for those premiums and some of those co-pays. So that can be really significant. And I have some good news. They're actually upping the cost on what people can qualify for. So the income levels are increasing in 2025. So more people will qualify for that program. The other thing I find is that people have some issues navigating formulary problems. And this is really important. I want to spend a little bit of time talking about formulary, because this is going to be really important when I get down to the part where I talk about Medicare Part D. So every drug or every insurance company is going to have a list of drugs of what they cover. And they're usually disease state specific. So they'll say, okay, you have high blood pressure. And I'm going to use ACE inhibitors as an example. ACE inhibitors is a class of blood pressure medicines, and there's like 10 of them in that class. Well, they'll say, we really want you to be on that one because that's the most cost-effective, that's the most therapeutically effective medicine. So they say, okay, lisinopril is what we cover. Well, then you go see your doctor, and they prescribe something else in the same category. So you go to your pharmacy, and they're like, oh, it's really expensive. Why is it so expensive? And really it comes down to is that your doctor chose something that was not on the preferred formulary list, okay? Real easy to fix, okay? What happens every year is every insurance company will also go through the process of evaluating their formulary to making sure that it's cost-effective and clinically the most effective drugs. So this is the time of year that you should be receiving notification of formulary changes to your insurance plan. So you are required to get a letter in the mail, but I am here to tell you that letter that comes in the mail looks like junk. So be very cautious about what you throw away this year, unfortunately, because some of that stuff does look like junk. It's very automated looking, but it does have important information. And your doctors are supposed to get notification of that as well, so they should be ahead of the game trying to say, okay, it looks like we're switching from Eliquis to Xarelto. We need to make sure by January 1st we get you that new prescription of Xarelto. But a lot of times people chuck it. So January 1st rolls around, they walk into their pharmacy, Mr. Smith, you have a $400 copay. What? And so that's something that can be easily fixed ahead of that January 1st timeline. But again, this is the time of year that people will get notification of formulary changes. The other thing is prior authorizations. Some medicines, some insurance companies make people go through steps in order to be, they require the doctor to submit more clinical information to make sure that this is an appropriate use of that medication. So there are sometimes people have to go through some extra steps to get medications approved. Again, what's happening in our system is doctors' offices are employing people to make sure that those things don't slip through the cracks. You have case managers and nurse navigators that help people navigate these issues. So if you ever run into the pharmacy and they're like, Mr. Smith, this kind of is an issue, we need to navigate this with your doctor's office, there's usually somebody in the offices that is helping people navigate those issues. So don't be afraid to call your doctor's office if you run into a barrier at the pharmacy. The other thing is the dollar store is awesome. I'm telling Cambridge Dollar Store, it's a little bit the Dollar Tree. I'm going to use the Dollar Tree as an example. Not all Dollar Trees are equal. I'm just going to say that. Like the Dollar Tree in Cambridge has an amazing selection of over-the-counter medicines. Really impressive. So if you're somebody that takes Tums, or even some of your heartburn medicines, like or even allergy medicines, it has actually I have 4 kids. I have 23, 21, 20, and a 16-year-old. And when my kids' friends and graduated college, my gift to them when they graduate high school is what I call the college pharmacy. And so I put a bin of medicines that you may need, like Tylenol and Motrin and things like that, and I gave that as their graduation present. But I'll tell you what, most of that stuff came from the dollar store. There's a really good selection of over-the-counter medicines that you can maximize your cost too. I also like the Dollar Tree because some of them, sometimes if you were to go to other pharmacies, they give you a huge quantity. So you may not be somebody that goes through a bottle of 100 Tylenol or Motrin, but you can have the option of getting a 30 count, which can be very helpful and you don't have to trash. So I like some of the quantities are very nice to have that smaller quantity at the Dollar Tree as well. But they're not $1 anymore, they're $1.25. Okay, this one is really, really, really important. And I feel grateful. I started in this oddball pharmacy position in 2016. This story that I'm going to tell probably happened in 2018, but it taught me the importance of advocating for yourself and others, and also going the distance in those fights. Okay, so what I mean by that is a lot of times there may be walls that are erected that say, "Oh, you can't have that medicine." We're rejecting that claim. I'm here to tell you about Mrs. S, who she was up at the Chestertown location. She was prescribed. She actually kept coming. Unfortunately, she had stage 3 ovarian cancer. Her cancer was actually very stable, but she had a lot of pain. And she kept coming back to the hospital for pain management. They were throwing the kitchen sink at her. They were giving her narcotics, anything that you can think of to manage her pain, muscle relaxants. And they finally found that lidocaine patches helped her. Lidocaine is not addictive. It's very mild. It didn't sedate her. It didn't cause constipation. It worked for her. And the prescription strength is 5%, okay? Unfortunately, when the doctor sent the prescription, she got rejection. So we're like, we're going to appeal that. We're going to appeal that bad boy. This is something that works. We don't have to have a narcotic for it. They rejected the appeal. So I will say, in that meantime, I was thinking to myself, how are we going to navigate this for this patient? Lidocaine actually also comes in a 4% strength as well, over the counter. She was using multiple patches a day, which was, helpful for her. And it was kind of adding up. So you use multiple, even the over-the-counter cost was adding up for her. And so but her family kind of rallied around her and said, okay, we'll get this covered for you. They ended up, I got a phone call from the insurance company, and the woman said to me, she's like, we just want you to know that we've, rejected the appeal. Can you acknowledge that appeal? And I said, no. I said, this is insane. I said, you found a non-narcotic medicine that helps this woman's pain. It's so amazing. She's got stage 3 ovarian cancer. It works for her. She can have higher quality of life. She's not sedated. Do you know what the lady said to me? Okay, we'll cover it. So that was a really big lesson for me. And what I've come to learn is people don't take the fight to the next step, okay? And there are provisions in most insurance companies for people to take that fight to the next step, okay? And so that story, I tell that story a lot because, I actually am getting chills about it because I just remember feeling like so elated when she said that, because that's what worked for her and helped for her, and it was a manageable copay. So that's an example for me. And this goes for things like chemotherapy, and a lot of the dermatologic agents that people use are expensive too. You can really fight for those things. And even sometimes people have side effects to, like, maybe the agent that's on the formulary. You can, I'm actually working with a man right now who has neuropathic pain, he was prescribed Lyrica, which is it's a higher level drug, and the preferred agent on its formulary is something called gabapentin, but he has an allergy to it. They rejected it, they rejected the Lyrica, but, not even thinking about, like, he's got this allergy to gabapentin. So again, you can go the distance. Your doctors have people in place to help people go the distance. Also, one of the things I do, So I go to the senior centers once a month. There's 10 in our area. And what I do is I start with a medication talk, like a tip. I'll do, this month actually is how to talk to your health providers about medications. People don't know necessarily how to answer, what questions to ask or how to ask it. And I do think it's very important for people to navigate those issues. Now, I'm telling this story about a lady at one of my senior centers who, you know, a lot of times also people in the community have some mistrust in healthcare. And I saw her, she eyed me up for a couple months, and finally she got the nerve to come up to me, and she brought me this dilapidated bottle of an eye drop. It was an eye drop bottle, and she was like, I'm only taking this 3 times a week because it's costing me $90 a month. She had glaucoma, and I was like, let's see what we can do. So I asked her for her what prescription plan she had, and I did a little bit of research, and really what was happening to her is her ophthalmologist was prescribing her an eye drop that was not on her formulary. So when I looked up her formulary, and there was a comparable agent, $4 a month. Here's the lesson. Here we go. So I found that out, and I called her ophthalmologist. I said, you know, can you change her to this medicine? This is the preferred agent on her formulary. It'll only cost her $4 a month. Here's the story. The ophthalmologist said to me, why didn't she tell me? So my story is that you know, again, that doctor, she's a great doctor, that ophthalmologist is a great doctor. A lot of times people feel pride and, you know, want to honor what their doctor is saying, so they say, you know, they will, you know, I've had a number of people tell me, you know, they got to the pharmacy in January and it was too expensive, and they go to their doctor multiple times, and the doctor thinks they're on the medicine and they're not taking the medicine. I mean, really, really important to advocate for yourself. And most doctors want to help you navigate that stuff, you know? I mean, I will say the computer systems are getting better to try and help doctors identify what's on your formulary a little bit better. So the systems are getting better to help doctors be more mindful, but there may be a simple fix like a formulary issue, and you just got to make sure you tell your doctor. This is my story. Again, I told you about my alarms, but I can't wait to tell this story. So I had a husband and wife team who, between the two of them, were taking medicine 5 times a day. They were terrible at the midday doses. I mean, they really were forgetting the midday doses quite frequently. So guess what? We found an alarm clock on Amazon for $25 that we programmed their grandson's voice into the alarm that said, Grammy, take your medicine. Grammy, take your medicine. And I'll tell you what, changed their life. All of them, they had that little alarm clock, and it was perfect for them. And that was a system that worked for them. They needed something more than just the alarms or some type of a reminder system in it. That alarm clock changed their life. It was $25. You can program it, actually, I think 10 times a day. So we programmed it with their grandson's voice to say, take your medicine, and it worked for them. So there's a lot of systems in there. And so alarms are awesome. I don't care what it is. You can, iPhones will do music. They'll do voices. There's a bunch of different things that, you know, your smartphones can do. And I said this too, preventive medicine's real important. I think everybody should make sure they go through the screening so you don't even have to take medicines. You know, screening's really important. Vaccines too. One of the things that I get asked about is a lot about vaccines, shingles vaccine, RSV vaccine. You know, here's the thing. I personally don't know anybody that had polio. Does anybody else know anybody that had polio? Maybe a handful. Okay.
Quite a few.
Somebody had to be the first people to go through the vaccine so that we could roughly eradicate it. So vaccines have amazing history of, I mean, my kids didn't have chickenpox. You know, we've come a long way with vaccine science. You know, so I am a fan of vaccines, and I am, you know, I know there's a lot of debate about COVID and pneumonia, but you know, if you have an underlying illness, you know, flu, for example, I'm an advocate for flu. Flu is not really what kills people. It's the superimposed infection like pneumonia that kills people. So we want to prevent you from getting that flu that maybe you can tolerate the upset stomach, the diarrhea, the fevers and things like that. It's the pneumonia that people die from. So we want to prevent the flu from developing into a pneumonia. The other thing is we're going to talk in a couple minutes about Medicare. That's it's my number one tip. Lynn Randall interviewed me for a radio show and she asked what my number one tip is. It is definitely about Medicare Part D. So I am also a fan of having another set of ears at your appointments. And here's the thing: you may not have somebody that's physically, maybe you don't have a spouse or a family friend or a sibling or a son or daughter. But guess what? If you have a phone, that's another set of ears. So if you feel like you need somebody to hear that advice, ask your doctor. Can I call my son that's a doctor? And listen. Can you reiterate that information so that person can hear it? You can have that. You can ask for that so that you feel confident that you can get that information that's being explained to you, re-explained to you by somebody that maybe needs to hear it too. I am really a big fan of that. And that's not something that anybody should turn away from in making sure that you get that information that you need to know. The other thing is, when I was in pharmacy school, we had a fake pharmacy. So it wasn't a fake, everything in the pharmacy was the same. It had the computers, it had the medicines that were probably expired from another pharmacy. And one of the number one things that we were taught while I was in pharmacy school was how to counsel patients. So you may think of your retail pharmacists, and they are probably very busy. They're overwhelmed processing prescriptions. But they are trained to make sure that you know how to take your medicines and to navigate barriers to you taking your medications appropriately. And guess what? Probably if you polled them, they'd want to talk to you about your medicines. So please don't be afraid to ask if you need clarifying questions. The pharmacist is going to be somebody that you can use as a resource, and they really do have the training to make sure you understand issues that could be related to your medicines. All right, I debated on how I wanted to start about Medicare Part D, if I wanted to make it first, but I'm making it last. Kelly's going to take the tail end of this presentation. But this is probably one of the most important things for me that I feel very strongly about. And this is something I really want you, if you walk away from this presentation, I want every year for you to feel that you are on the best Medicare Part D plan that you could possibly be on. There are people that probably could be saving money that don't necessarily realize it, okay? And it's something that you need to do every year. And if you had asked me what my next kind of tips would be a week ago, it would be different from what I'm going to say next going forward, because I have what I called myself immersed myself into Medicare. So I called myself Medicare Melanie because there's some things that have happened that I don't think they're well publicized. Okay, so open enrollment is through October 15th through December 7th. You can go on Medicare, if you're savvy, you can go on Medicare.gov. And it's a very user-friendly site. You just basically have to have your medication list, your zip code, and it allows you to kind of shop plans, okay? So it's a really very well done site. I've been very impressed by it, okay? So the next thing I would have said a week ago would be, listen, every county has these wonderful people, and there's a flyer about there. They're called SHIP, or State Health Insurance Program people, and every county has these people that help people navigate insurance issues. So our person in Talbot County is at Brooklet's Place. Does everybody know where Brooklet's Place is? Her name is Mayla Ryder, and I have a slide. I'll go into that in a second. But really, the reason why I like referring people to the SHIP coordinators in their county is because their job is to maximize your out-of-pocket costs so that you're not getting screwed with in terms of the amount of premiums and deductibles and things like that. And they're not getting a kickback. They're not getting a commission based on what insurance. They're going to give you the best advice possible. With that being said, I'm happy to report that this year, there's some significant things that are happening with Medicare. And initially, I mean, I've known about the Inflation Reduction Act for a while. I mean, I think one of the things that disappointed me when it first came out, let me start with a positive. One thing that it did was it actually, right off the bat, it said, we're going to cover preventive medicine. So one of the things prior to the Inflation Reduction Act that I did was I helped people try and get shingles covered. Most people had a copay with Medicare that was $150. Well, now with the Inflation Reduction Act, you can get those vaccines for free. You should not be paying any copay being on Medicare for shingles, RSV, pneumonia, flu shots. With that being said, there's this rollout part of the Inflation Reduction Act that's happened. And some of the things you hear in the news, it's been, obviously insulin they're capping the cost of insulin per month per prescription. The biggest thing that is very significant for me that made me go down the Medicare Melanie rabbit hole was there is going to be a yearly cap that every Medicare recipient is going to, you're basically going to cap out at $2,000 a year for your expenses. And that includes everything. That includes your premiums. Yes. That is, yes. So I want to tell you, yes. Okay. This is very important. So they're trying to change. I'm gonna have to get out of this terminology. So basically, what they want to get rid of, we're not going to hear the donut hole anymore. Does anybody know what the donut hole was? Yeah. Okay. So the donut hole, just for people just to clarify, is prior to this year, your insurance company had a max amount that they were going to spend out of pocket for you. For most Medicare patients, it was around $5,000. So if they put out $5,000 for you, you then entered the donut hole. That was a period of time that you were going to be responsible for the cost of your medicines. Then they said, okay, you have to spend, I'll use $3,000. You have to spend $3,000 of your own money for the rest until you hit $3,000. Then you can go into catastrophic coverage, and then you're only responsible for 5% of the costs. Inflation Reduction Act, here we go. Here's the big part. Now they're getting rid, they don't want to talk about coverage gaps. They don't want to talk about donut holes. They don't want to talk about, they're saying now, no matter what, premiums, deductibles, and co-payments, when you hit $2,000, you then pay zero. So Medicare Melanie, sorry, this sounds so, it made me so skeptical. I'm sorry, I'm very mistrusting. It just seemed, I can't believe our government would be doing this. I'm just pleased, but yet shocked, I guess. I don't know what to say about it. So what I did is I spent my weekend pretending like I was a Medicare patient. One instance, I was a patient with diabetes and heart disease. In another case, I was a patient with dermatologic issues. In another one, I was a patient with atrial fibrillation. And then I was all of those people with all those disease states, with emphysema and all that stuff. And I'll tell you what, I was truly impressed with the way the Medicare website breaks down things. It allows you to say, listen, this is what your premium is. This is what we estimate your out-of-pocket expenses are. And some of the plans, depending on what I chose, you're allowed to kind of compare plans and look at, and there's actually a plan out there where you can pay a $0 premium, you have no premium per month. And what it did, and it showed you what your deductible was. Most deductibles for a lot of these plans are $590. That's a very common number, $575. And then it allowed you to see what you would be paying from January to December. And every single thing I did, as soon as I got to $2,000, every month after that $2,000 was zero. So it looks really amazing. It looks like that is really going to be a cap amount of $2,000. Now, I want to say a couple things. The plan you pick, you need to make sure that the medicines that you take are on the formulary. So that $0 plan that I was telling you about, I put 10 drugs in for one of it, and they only covered 7 out of the 10. So you have to make sure the plan that you pick covers your medicines. And you can see in the language of the law that they're if it's covered by your formulary, so it's very specific about making sure that you will pay no more than $2,000 if your medicines are on your insurance formulary. Very important. Okay? Make sure your medicines are on the formulary. The other cool thing about this Inflation Reduction Act, which I think is awesome, is they're allowing people, okay, if you project that you are going to spend $2,000, if that you're going to hit that cap, or even if you hit $1,600, okay, they're allowing people to set up a payment plan. So they'll say, okay, your deductible and your premiums and things like that. So instead of saying like, okay, a lot of times that deductible really sucks for people in January. They don't want to pay the $600. They want, that really hurts for people to pay that in January. What they're allowing people to do is make a payment plan. So instead of paying all that upfront in January, they're allowing you to set up that payment plan. So based on what they estimate your total cost to be, that would be divided by 12. So you don't have to pay that deductible all up at front. It'll be something that you can set up a payment plan for. The other thing is they're also expanding the number of people that should qualify for extra help. Okay, the extra help program are the ones that help people pay for premiums and things like that. The state of Maryland, and actually that one of the flyers I have out there too, the state of Maryland also has a senior drug assistance program. It's pretty generous for people. And what that does, they will pay up to $75 of your premium per month. And the one thing that's cool about the Inflation Reduction Act is they're allowing that cost to be considered into your total $2,000. So even though you're not paying that $75, they're allowing that to count towards your $2,000 amount. Do you understand what I said? I hope that's a hard math concept to understand. So what I mean, say you pay your premium is $86 a month. That's going to, that's $86 every month can add up to times 12. It's close to, $1,000, let's just say. So what they're saying now is if you qualify for that state assistance program, that you'll only be paying $11 a month because it's $75, 86 minus $86. So you're really only paying $11, but they're allowing you to count the whole $86 to that $2,000. It's really nice. So it's basically saying that really for those people that qualify for that program probably have a max out-of-pocket expense of $1,200. The other thing that happened with the Inflation Reduction Act is they're allowing Medicare to negotiate prices of really expensive medicines with Medicare. So that's really helpful. The other thing that's happening is they're also saying that drug companies cannot increase their prices higher than the rate of inflation. So they're not going to price gouge. So there's a law in place now that will say that companies can't jack up the cost of their medicines. There's also a couple of changes with Medicare Part B. That's the kind of the hospitalization. So there's going to be some assistance programs with Medicare Part B as well. So there's actually some really good things that came out of the Inflation Reduction Act. I want to put a disclaimer because I'm so happy about it, but it seems like, wow, I don't know. And again, here's what I want you to, but ultimately the bottom line is, and I think hopefully it's my next slide. Well, here's some actually also helpful links about this. It'll be in your flyer too. That top website is where you can see how you can compare plans. You just put your meds in there. The next one is the website to the Senior Prescription Drug Assistance Program, Medicare Extra Help. And also, this actually has some really great information about the Inflation Reduction Act. And I kind of already talked about this. This is what I tell you when I was Medicare Melanie. But really, the takeaways really are that, I feel like prior to this that there were a lot of people that couldn't be on brand name medicines because it was financially unaffordable for them. This is allowing people to be on the most novel medicines that are innovative, that really treat disease that are new and upcoming. So I think this really takes, we use equity a lot these days, but there is some good things that are kind of leveling the field for all people, depending on what their status was. But this is the slide I wanted to be at. So this is basically where I would have kind of stopped. So I feel like it's very confusing to navigate the insurance issues, okay? So the flyer that I handed out is this one that right here. It has kind of what the SHIP coordinators do. Mailer Rider is the one that I was telling you about that's up at Brooklet's Place. Her contact information is there. You can start setting up those appointments now, and she is so helpful to help navigate that. I actually recommend people setting up an appointment with her every year. I don't know what's going to happen. We have elections. I don't know if laws will change, but I really think my number one tip is to make sure that you are optimizing your Medicare Part D plan. Oh. Okay, I'm going to give my mic to Kelly, who's going to go into some a little bit higher level things. There's also some pamphlets back there and flyers that will kind of relate to her topic as well.
Unfortunately, I can't tell you how to save money. Melanie had the best news of the night, right? So I'm going to talk about safety of taking your medications. So 5 moments for medication safety. When you start a medication, you want to realize what the name of that medication is. Like, this is something you need to have a conversation with your provider with. And what is it used for? What are the possible side effects? Second is taking your medication. When should this be taken? Like Melanie did a great deal setting your timers. When should it be taken? Is it better to take it in the morning or in the evening? Should it be taken with food or without food? What should you do if you have a side effect? Third is adding a medication. Is it really necessary? And that's where your list comes into play. Like, is that really necessary for me to add another medication to my regimen? And can it interact with any of your other medications? Reviewing your medications, the list is so important. Melanie talked about like having it in your pocket, in your purse, in your refrigerator. Also, I tell my patients to have it on their phone. You always have your phone with you so you can show your provider. And stopping your medications. Who do you discuss that with? Why are you stopping your medication? So what is the Beers criteria? It's not a list of your cocktail for the evening, for sure. So back in the 80s, a geriatrician by the name of Mark Beers, he was out of Harvard University. He assembled a team, and they went out into the Boston area, and they went into nursing homes, and they explored what medications seniors were on in these nursing homes and how they might harmfully be affecting them. They recorded emergency room visits, their case histories, and in the early 90s, they published the first Beers criteria. So there's 5 sections to this. The first being medications to avoid if you're 65 years old and not in palliative care or hospice, medications to avoid among people with certain health conditions, medications to avoid that cause drug interactions when combined with their other medications, medications to avoid due to harmful side effects that outweigh the benefits, and medications to use at limited doses due to our kidney function. So, why are older adults different? Just like you notice as you get older, you're not seeing as clearly or hearing as clearly, stuff is happening internally as well. We might not be digesting our food the same. Our kidneys and liver aren't working the same. So the medications aren't utilized in our system similarly to when we were younger. Also, as Melanie pointed out, nearly 50% of patients 65 and older are on 5 or more medications. That's crazy. So there's beer list medication categories, and I'm going to review a few of them. I'm not going to review the whole list because we would be here all night, but on the back table is the Beers list criteria. So I want to have a disclaimer here. Just when you review this list and you see medications you're on, that doesn't mean necessarily that you shouldn't be taking them. This is a conversation you need to have with your healthcare provider. It's just a guideline. First, we're going to go over anticoagulants or blood thinners. So just this past year, they included aspirin, a baby aspirin. It seems pretty harmless, but there are associated events of bleeding with it. So they're suggesting that it's only used in patients who have had a cardiovascular event or a stroke. So not to use it every day for prevention. Second is warfarin. They're recommending if you're 65 and older to avoid initial therapy unless you have mechanical heart valve placed. And third was rivaroxaban, which is the same as Xarelto. You all see the commercials, right, for the Xarelto for AFib. They're suggesting to avoid for long-term use in the treatment of atrial fibrillation, just because how it's cleared through the kidneys, and it might set you up for a bleeding event. Next, I'm going to go over NSAIDs, which are, again, also a blood thinner. These are examples: ibuprofen, naproxen, indomethacin, meloxicam. They put you at increased risk for bleeding, and they also affect the kidney. True story, my mom, she had her aches and pains. She was dealing with sciatica. She was taking over-the-counter ibuprofen, 800 milligrams 4 times a day. 4 times a day. And her daughter's a pharmacist, right? So, of course, she goes to get her yearly blood work done, and her creatinine was through the roof. Her kidney function was, like, not good. So she stopped the ibuprofen, and she doesn't take it anymore. She sticks to Tylenol. Next, I'm going to go over CNS medications for your central nervous system. First generation antidepressants. I'm not sure many of us take this much anymore because there's been, SSRIs. That's usually the guidelines we start with. But some examples of first generation antidepressants are amitriptyline, desipramine, imipramine, barbiturates, benzodiazepines. Examples of those would be your alprazolam, lorazepam, diazepam, and non-benzodiazepines. That would be like your sleep aids, like your Zolpidem. So they're suggesting you not take these. It puts you at an increased risk of falls, which would then lead to fractures, delirium, and confusion. I'm sure we've all heard the stories about people on Ambien cooking themselves dinner in the middle of the night and not remembering it. I don't know if you guys have heard that. Antihistamines, unless being used for the treatment of an allergic reaction, there's increased risk of falls, confusion, dry mouth, and constipation because, again, they're an anticholinergic. So you can have an accumulation in your body because our kidneys aren't working as well when we're older. We're not clearing that medication accumulation, and we have those increased anticholinergic effects. Next are GI medication, proton pump inhibitors. They're recommending, unless you have gastric reflux disease or a bleeding ulcer, maybe not to be on it long term because it can increase bone loss. That study just came out a couple years ago, and then you're at a risk again for fractures. And it also increases C. diff infections. I'm not sure if you're familiar with C. diff, but it's a bacteria that lives in our body naturally, so it can lead to overgrowth of that bacteria in our bodies and cause an infection. Cardiovascular medications, dipyridamole can cause orthostatic hypotension. That's that feeling like when you get up too quickly and you're dizzy. Alpha blockers, which would be like prazosin, they cause orthostatic hypotension as well. Clonidine and guaifenesin, CNS effects. Nifedipine can cause hypotension and myocardial ischemia. That's like lack of blood to your heart. Amiodarone and digoxin. Now they're recommending to avoid these as first-line therapy for atrial fibrillation. Digoxin has just such a small therapeutic window and can cause toxicity, and it's also based on your kidney function. Now, that's not to say if you've worked with your cardiologist and nothing else has worked, you might end up on these medications. But again, that's a conversation you'll have with your healthcare provider. So why do medications work differently in older adults? It takes longer for your body to break down medications, and so it may stay in your system longer. Treatment for one condition may affect another. Certain medications can change the way your body responds, and this can influence how well other treatments work. And lifestyle changes. Your activity level and diet aren't the same as they were when you were younger. and it can influence how well certain medications work in your body. What are side effects? Side effects are an unintended reaction to a medication, and they can manifest due to age-related changes in the body, interactions with other medications, or long-term use of certain drugs. Some common ones include dizziness, fatigue, loss of appetite, digestive issues, and headache.
How about ringing of ears? Ringing, tinnitus.
Tinnitus, yes, that is very common with certain medications.
It is?
Yes, it is.
It seems to be getting more common with the elderly. Is that because we're on those medications that cause that?
It just depends on what medications you're on. There's only certain ones that can cause that, and it also can come along with being old, getting older. Unfortunately, yes.
Okay.
So how do we manage these side effects? So active monitoring for any adverse reactions is the key to managing medication side effects. You can communicate with your healthcare provider and ensure optimal care. It may involve making necessary adjustments to your medication routine, like Melanie had talked about. You know, if a medication is keeping you up all night, let's switch it to taking it in the morning. Or if it's making you drowsy during the day, let's switch it to nighttime. If it's upsetting your stomach, let's take it with food, that kind of thing. So each medication side effect requires a unique management approach. And I say this to all my patients, like, we're all little snowflakes. Everything is going to affect us differently. I've had patients who are 90 years old and never had an adverse reaction in their whole life. Then I've had patients, I'm not lying, 27 drug allergies listed. 27. Like, so everybody is just different. So promoting medication safety is paramount in managing medication side effects. We all want everybody just to be happy with their medication routine and feel better. So interactions. And Melanie said this, the best strategy is to make sure interactions are identified is use your same pharmacy. Your pharmacist will review it every time something is added new to your profile. And like she said, it's best to let them know what vitamins you're taking, just so everything is on your profile. So 5 common food-drug interaction. Calcium and antibiotics, so tetracycline, ciprofloxacin, levofloxacin. We recommend that you take it 1 hour before, 2 hours after a calcium supplement. Dairy products, some antacids contain calcium as well. So what it'll do is your antibiotic will be less effective. Tyramine and MAO inhibitors. What are these MAO inhibitors? Honestly, there's only really one that is prescribed routinely. It's the Legiline. It's used in Parkinson's disease and depression. But tyramine can be found in pickled, cured, and fermented foods. It's in red wine, aged cheeses, processed meats, and it can lead to high blood pressure. Vitamin K and warfarin. Is anybody on warfarin here? No? So warfarin hopefully is managed by a Coumadin clinic. And vitamin K is found in green leafy vegetables such as spinach, kale, and broccoli, and it'll decrease the effects of warfarin, which is a blood thinner. Alcohol and stimulants. And they're saying alcohol should be avoided in all drugs. I know that's very difficult, but some drugs you just should absolutely not take them with. Stimulants is one. Another is an antibiotic called metronidazole. It can cause severe vomiting and GI issues. And then grapefruit juice and statins. So when you do take these two together, unfortunately, you get a higher level of your statin in your body, which can lead to adverse effects such as rhabdomyolysis. And that's it.
Rhabdomyolysis?
Yes.
Mouthful. What is that?
Rhabdomyolysis is when your muscles start breaking down in your body, your muscle tissue, and then your kidneys are trying to clear it, and your kidneys can't totally clear it, complete that muscle tissue completely, and then your kidneys start to shut down.
Guess what's happening now? You're getting a quiz.
Oh, really? Passing score.
Well, we're not going to grade it. We'll go over it. I want everybody to just kind of go through the questions. There's 6 questions on here that kind of highlight some of the things that we talked about.
While we're passing these out, I have another question.
Sure.
So, my sister uses these apps on her cell phone to look for best prices for in different pharmacies.
Uh-huh.
And I often wonder, when they're looking at generic drugs, are they all the same? For example, are there different moieties in furosemide or PNP, SMX? I mean, people don't know what I'm talking about, but from one generic manufacturer to another, do they, for example, I'm using a technical term, but like there are 18 moieties available in TMP SMX. Are they all the same? And is there some jeopardy in going from one pharmacy to another just to get the cheapest price?
The way I think about generic medicines is I think of it as, like we always hear, I'll use metoprolol. Metoprolol is a medicine for use for blood pressure and for atrial fibrillation. But if you heard the whole name, there's metoprolol tartrate and succinate, and there's salt. That's called a salt. So when we add that second little succinate, it's a salt. So drugs are made for stability purposes, and so the salts kind of are stabilization for how it's kind of like a chemical. We want to stabilize the chemicals and things like that. So the generic has to be equivalent to the brand. So they can't really mess around with what we call, like the drugs in there, but there's also something called excipients. I'm using big words now. Excipients are like what binds the drug together or makes some flavoring is considered an excipient. So or the stability, they'll add stability to change the pH of it. So that can be a little bit different, but it's not meant to affect
The active drug is the same.
the active drug is the same, okay? That's a good question because that is kind of important. So one thing I do want to say about costs. So the gold standard for cost, was Walmart. Actually, Walmart came up with something called the $4 list. It's still technically the $4 list, but I feel like they still call it the $4 list, but I still feel like I see some things are $5. So they try to be the standard in our industry. So you would hopefully go to the Walgreens and see a comparable price. Sometimes it's 15 cents difference and things like that. But most of the generic drugs are going to be roughly around the same. One thing to also note, this is kind of a tip too, when drug companies are allowed to formulate when a new drug comes on the market, they have that time frame where they're allowed to sell, and they're the only ones that are on the market. Well, once they come off patent, generic companies can make it, but unfortunately, it takes a while for the market to catch up to see really good cost savings. So even these brand name drugs that immediately go to the generic, they still might be pricey. So they may not necessarily be on people's formularies and things like that. So there's a period of time where it takes the market to catch up to those really good generic costs. So you'll find that there are drugs where oh, that's a generic. Why is that so expensive? It's because it takes a while for those really huge cost savings to come
But a
out.
manufacturer might have exclusivity on that one generic. So they're going to try and make as much money as they can at that point in time before other generic companies are invited to make the same thing.
So you need to check that out almost every year.
Yes.
Every year.
Yes.
So number one thing, if you have a new health event or new medicines, that is an absolute, no exception that you make sure you're on the right plan because things can change, so you really need to make sure if you're on those brand name meds or if you had a new health event to make sure every year that you're on the optimal plan to have the best coverage.